Hello, my name is Dr. Dewan S. Raja. Today I will discuss about metabolic syndrome. What is metabolic syndrome? Metabolic syndrome is a cluster of conditions that occur together, increasing the risk of heart disease, stroke, or cerebrovascular accident, insulin resistance, type 2 diabetes, hypercoagulability, and pro-inflammatory state. The main features are as follows: abdominal obesity, a lot of fat around the abdominal viscera, excess fat in the abdominal area, often measured by waist circumference, high blood pressure, hypertension, blood pressure consistently higher than normal levels. Due to the pro-inflammatory state, there is also increased chance of getting atherosclerosis. Okay, then we'll go to the high blood sugar, elevated fasting blood sugar level indicating insulin resistance and impaired glucose metabolism. High triglyceride, elevated levels of triglyceride, a type of fat found in the blood. Low high density lipoprotein, cholesterol, low levels of the good cholesterol that helps remove other forms of cholesterol from the bloodstream. So HDL will be low, LDL will be high in a patient with metabolic syndrome. So out of these 5 features, at least 3 features should be present before declaring a person have metabolic syndrome. Out of these 5, at least 3 should be present to diagnose a case of metabolic syndrome. So what are the criteria for metabolic syndrome? We have 5 criteria. We must have at least 3 criteria, like low levels of HDL cholesterol. High density lipoprotein cholesterol will be low, which is actually protective. That is the good cholesterol. Okay. Elevated blood sugar level, there will be hyperglycemia. High blood pressure. Excess weight in the abdomen, there will be central obesity, abdomen will be protruded anteriorly, a lot of fat around the abdominal viscera, and hypertriglyceridemia, excessive blood level of triglyceride. What are the symptoms? So out of these 5, at least 3 should be present to diagnose metabolic syndrome. Symptoms of metabolic acidosis: there will be tachycardia, increased heart rate, feeling very tired, fatigue, confusion or dizziness, loss of appetite, breath that smell sweet or fruity. This happens in the late stage. We may have diabetic ketoacidosis, and there will be acetone breath, one of the keto acid that come out of the breath. Rapid breathing, long deep breathing, another feature. Then nausea and vomiting, headache, and feeling weak. So these are the common symptoms of metabolic metabolic syndrome. There is metabolic acidosis happen in this person because of the excessive presence of keto acid. The exact cause of metabolic syndrome is not known. but a combination of genetic and environmental factors such as poor diet, lack of physical activity. Poor diet means that fatty food or maybe fast food, a lot of trans fat, less and less fiber, lack of physical activity and obesity are believed to contribute to its development. So obesity is a factor. Sedentary body habit is also another factor for development of metabolic syndrome. Early identification and management of the syndrome are crucial to preventing this health problem. Lifestyle changes such as adopting a healthy diet, so avoiding fast food, eating a lot of vegetables, fresh fruit, increasing physical activity, maybe walking at least 3-4 miles a day, and losing body weight are often recommended as first-line treatment. In some cases, medication may be prescribed to address specific components of metabolic syndrome. Suppose a person has hypertension, that person should have anti-hypertensive drug. A person of high cholesterol level, he can take the cholesterol lowering drug, so he should consult with a physician in both the condition. And that's all about the metabolic syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.